So hi guys, today let us discuss this challenging case of multiple post burns contracture. So as you can see, we have contracture of the elbow, contracture of the dorsum of the hand, and contracture of the wrist as well. So we have multiple burn contractures, and before we begin discussing this case, I'll give you a brief history. So this is a young female, 13 years old, and the duration of the contracture is 1.5 year. There is significant hypertrophy of the scar over the deltoid region, over the elbow region, over the wrist, over the dorsum. The wrist appears to be a bit subluxated. The contracture is significant. As you can see, the patient is functionally debilitated, and even doing activities of daily living is a problem for this particular patient. Now there are multiple issues to be discussed over here as to what would be the best course of action. In the end, we will see our post-op outcomes with its own set of complications as well. But for now, let us discuss this case clinically so that we come to discuss some important points about this. So what are we going to discuss in this video of case discussion? We have contracture of elbow, wrist, hand. Which contracture do we release first? Elbow first or the hand first? Or can we together release all these contractures in a single surgery? If we are going to release them in a single surgery, what do we release first? Do we release the elbow first or do we release the dorsum of hand first? Does it really matter? How does it matter? What problems might occur if we release the elbow first? What problems might occur if we release the hand first? How should we resurface them? Should we use a flap? Should we use a graft? Or we should use dermal templates? How are we going to immobilize them? What happens in case of incomplete release? And how are we going to tackle recurrences? So for all these and more, stay tuned for the entire video.